The pandemic is far from over. Newer variants, sublineages are coming forward. But what does it mean for India that has already seen a third wave with BA.2, one of the sublineages of Omicron, already having infected, and India has seen a large exposure? We'll speak to experts. I have with me Dr. Gagandeep Kang, who is working at the CMC Vellore. She is a scientist and virologist and has been looking at the pandemic with a very close eye. Thank you so much, ma'am, for speaking to India today. We have in the past heard of your views on various things, vaccinations, whether precautionary doses should be given or not. Do you think that we are at such a comfortable stage in the pandemic right now that we can take a chance to do more research on areas like a pan-corona vaccine, for example?
I think there's never a wrong time to do research, but this in particular is a good time for us to frame the questions that will allow us to have answers ahead of when information is needed for the future of SARS-CoV-2. The pandemic is a pandemic, which means it's still all around the world. There is no real prospect of the disease not continuing to be in multiple parts of the world. But I think we are also at a stage now where we can consider this as a disease that's going to be with us for the long haul. And for any infectious disease, we need to find answers for prevention, for protection from severe disease, the duration of that protection, and the breadth of that protection. Only research is going to be able to give us the answers that we need.
There's a little bit of panic with regards to the XE. It's a recombinant variant, that's what it's being called, and people are saying that it's a hybrid of BA.1 and BA.2. One of the cases seen in Mumbai is being once again rechecked by the INSACOG labs, and they want to confirm whether it's a recombinant variant infection or is it someone who got multiple exposures. Is that even possible, multiple exposure, and what is XE?
So, being infected with two viruses at the same time can happen, and in fact is one of the ways in which variants can arise. When you're infected with two viruses, they get inside the same cell and they can exchange portions of genes that then results in a daughter virus that is not like either of the parents. So XE as a combination of BA1 and BA2, I don't think that we have any information that tells us that this is a virus that causes more severe disease. The only data that we have on the biological behavior of this virus that's a bit different from the variants that we've seen before is that it is about 10% more infectious than the viruses that have been seen before. And in a vaccinated population, that really does not matter very much. If we had something that was both more infectious and caused more severe disease, we should be worrying, but that's not the case now.
And ma'am, when we talk about the ongoing pandemic and also the fact that China is going under lockdown in bits and parts of their provinces, UK is witnessing a surge in cases, US as well once again. How important does the third precautionary or common parlance booster dose become at this moment? Because India is pretty comfortable right now. Is now the right time to boost immunity of our citizens?
I don't think we need to boost immunity of all our citizens at this time. We have a situation where in June, July of last year, 67% of the population was seropositive. The more recent sero surveys that have been done show that the proportion of adults who are largely vaccinated who are seropositive is about 90%, but more importantly, children who have not been vaccinated have about 80% seropositivity. which essentially tells me that after all the waves that we've had, 80% of India has been exposed to the virus as a natural infection. On top of that, we have 2 doses of vaccine that have been given to the bulk of the adult population, and certainly in the groups that are at greatest risk of severe disease. So I don't think the time is right for a booster. I think there is a lot more that we need to understand about how we respond to the vaccines that we have as a third dose by studying the immune response and then thinking about how well that correlates with protection from severe disease. We don't have all the answers, but I don't think that in general, healthy adults need to be receiving a booster dose at this time. The situation may change. We may have a new variant that would require a booster. We may find that the duration of protection really is relatively short given the combination of infection and vaccination that we have. But that evidence of waning of protection is not available in India today.
And also the fact that not any vaccine is not working to check Omicron or stop Omicron infection. Am I right?
Well, infection and disease need to be separated. Infection is what we get when we count cases, and disease is what we get when we count hospitalizations and deaths. And we've seen a large increase in the number of cases, but we have not seen our health system being overwhelmed. We have not seen a large increase in deaths. So that means that the vaccines that we have may not be protecting against infection, but they certainly are protecting against the severe disease that results in hospitalizations and deaths. And if they are working, then why do we need boosters?
Ma'am, you did mention that we don't have that granular data to assess how many people with vaccines were actually hospitalized in various parts of the country. Isn't that what will help us decide whether a person should require a booster, whether a person does not require a booster, and whether it's a comorbidity that's actually causing the burden of COVID-19 to cripple the person in terms, right? So data is the key here.
Couldn't agree with you more, Milan. You've put it really, really well. I'm actually using a substitute for that granular data, and that's the fact that our hospitals were not overwhelmed when we had large numbers of cases. Unlike what happened in the first wave in places like Delhi, pretty much all over the country during the Delta wave, where we saw the pressure on the healthcare system. And that told us that there were hospitalizations and a lot of severe disease being seen. We did not see that in January when we had the Omicron wave. So I would love more detailed data. I would like very much to see data that is categorized by age, by comorbidities, by hospitalizations, urban-rural differences, socioeconomic status. All of those are really important for the future. We should have had them. I hope we will have them. But even in the absence of that, the lack of pressure on the healthcare system tells us that for Omicron, the vaccines continued to protect against hospitalizations and deaths.
Ma'am, question of children, because they are the ones that are now exposed. They've been exposed to the infection as well. They continue to remain vulnerable. 12 years onwards, we've started vaccinating them, but looking at examples from other countries, of course, they may not be the markers that we may follow, but do you think that children, at least now when they've started going to schools, require that kind of protection by being vaccinated? And the studies, the lowest age group studies we are doing right now is 5 and 2, one that Bharat Biotech was also doing.
So I'm actually worried about vaccinating children without sufficient information. If I want to protect my child, I want to make sure that I am giving them the best vaccine possible. Do I know which is the best vaccine? We have not had head-to-head comparisons of the vaccines that are available for children in our country, let alone the vaccines that are available for children in other parts of the world. So we have gone ahead and started to give vaccines without knowing which one is best. We know good enough to induce an immune response, but is that sufficient? And to my mind, when this is a disease that causes very little severe morbidity and mortality in children, we could have afforded to wait and made decisions on what the best vaccines were before we started to vaccinate children. But that's my opinion as a scientist. The only thing that I think about for children, one, of course, all children that have comorbidities should be vaccinated, because I think we know that they do develop more severe disease. The one outstanding question that really troubles me is, what is the incidence of long COVID in children if they've had an asymptomatic infection, which is the bulk of children in our country, or if they've had a mildly symptomatic infection? I actually have no data that is available that would allow us to understand what the burden of long COVID is in children, that could then allow us to do a risk-benefit analysis and decide whether vaccinating children should happen early with a good enough vaccine, or whether we can afford to wait and vaccinate children with the vaccine that gives them the longest lasting and broadest protection.
As well as safest. But my final question.
Vaccines are reasonably safe.
My final question to you, you're working on a very important study at the moment. We've all been eyeing the results of that. Mixed vaccines. So mixed vaccines in the third dose and mixed vaccines in your studies. What can we today be told from you about this study? Obviously, it happened by accident on 18 participants in Uttar Pradesh, and there also there were no serious or severe adverse side effects that were seen after the doses were mixed. So what is the future of mixed vaccines at the moment?
So there are data from other parts of the world, including some of the combinations that are available in India, which is to have a viral vectored vaccine and an inactivated vaccine. And what those data show is that using heterologous doses can give you a better immune response than homologous doses. Where our own study is concerned, we are waiting to present the anti-spike IgG data to the regulators who gave us permission to do the study. We are also awaiting permission to do more detailed immunological analysis.
So that's all you will reveal at the moment about the study, but it does give us a sign that, of course, heterologous vaccines would perhaps be better than homologous vaccines, right?
Well, the COV Boost study, as well as studies that have been done in other parts of the world, do seem to indicate that heterologous vaccines may have a role to play.
Thank you so much, Dr. Kang, for speaking to us. And as the pandemic moves forward as well, we'll hear more research, more about science. But for now, at least vaccination in India seems to be picking up. And that is the message before we have any new variants entering the country. With Abhishek Singh, Milan Sharma for India Today.